Dr. Pavanka. I just wanted to talk real quick about prescription diets for our dogs and cats. So every once in a while, we will go ahead and have a pet who has something like kidney disease, urinary stones, diabetes. Sometimes we do thyroid, general things like that. Sometimes we put them on it for arthritis. There's usually joint specific therapeutic diets, and allergies are a really big one too, because we can help manage their allergies through diet if we have diet related allergies. And there's been a lot of research on the skin layers and how that looks as far as a healthy animal and an animal that has those allergies. So that's kind of a really broad repertoire of things that we use our prescription diets for. So I wanted to go over the general things that are specific to each diet. So with any diet change, we want to make sure that it's slow and controlled. We don't want any cold turkey. We're going to switch from this food to that food just because we do see the bacteria that helps them digest everything in their gut get upset. And then we see vomiting, diarrhea, and that's the last thing that we want. So a lot of times we'll go ahead and do a slow transition. I've heard people that say that they do great over a week, going from mostly concentrated of the old food with a little bit of the new food mixed in. I've had dogs that have reacted with that, and I've had dogs that have reacted with a 20% change each week. So I've gotten to the point where I have an 1/8 change each week. So it's a total of 2 months to switch them over to the diet, just because I've seen enough dogs react with just the 1 month. But it's kind of specific to your pet, whatever works for you. I will say with these prescription diets, it's not fun because I just picture that it probably tastes kind of like what our doctors talk about when you need either a low sodium diet because you have blood pressure issues or you need a heart healthy diet. Because I don't know about you, but it always seems like the foods that are approved in those diets aren't the ones that you really want in most cases. And that's very much the same for our pets. In particular, we have the kidney diet that a lot of times has lower protein, and a lot of pets like to eat those higher protein diets. So with these foods, even though they're maybe not as palatable, and sometimes they are, sometimes like the OncoCare, the oncology diet that Hills has, they really try to make them really palatable, and sometimes they do add things in because they know that they're not going to want to eat it. But at the end of the day, a lot of pets don't like prescription diets, and it's really hard because we want to add things to them. But in reality, we're using food as a therapy, so when we add things to those diets, it actually can negate the effects, and then you're just spending a lot of money for nothing. So that's one of the hard things with a lot of these diets. There are medications that sometimes are appropriate that can get your pet to eat more, so they will eat their diet more. But sometimes you have to play around and see which prescription diet works for them. I had a patient years ago that she just didn't like any of the kidney diets, and usually I have that issue with our cats more so, but we were lucky that this was a dog because we found the diet that she loved when we looked at Just Food for Dogs prescription diets, and we found that kidney diet that they have. Because it's more of like a TV dinner for dogs, we had much better luck with her eating it, so I was very happy to have found that. It doesn't work for every dog though, because I've had coworkers that they tried that diet for their kidney dog that didn't want to eat it, and they didn't really want to eat that either. So it really depends on the individual. Sometimes we do have to cheat and give them something like mirtazapine or Entice, or for cats, Allura or Mirataz, just to get them to eat that diet because it is beneficial for them. But do talk to your vet about any questions you have about the diets, but know that the 2 basic things that I want you to take away from this video are make sure you do slow transitions and make sure that you go ahead and don't feed anything but that diet unless it's a treat that's approved to go with that diet. Do let me know if you have any questions or if there's anything else you'd like me to go over in one of these videos.